Hi, I'm Ginille, Cosmetic Nurse Practitioner. Since 2013, I own JASI Skin and Wellness medical spas. You can find us in Los Angeles and Las Vegas. I went to Stanford, I went to Duke. I treat all skin types, all skin tones, and it's not just me. I have an entire team of providers who are excellent and can help you getting to your skincare goals. In our office, we do traditional filler, Botox, all natural filler. So that one is made entirely from your own blood, your body's growth factors and stem cells, and helps your body to make new collagen wherever it's injected over time. Patients love that. That's probably our most popular treatment, in addition to our skin membership program. So in our skin membership, we have patients come in on a monthly basis. We are doing skin treatments based on their skin concerns and their goals. We have Aerolase laser, skin pin microneedling, hydrofacial, and bio repill chemical peel. I have not been live for like a week, so if you have questions, please drop them in the chat. If not, I will talk through these most commonly performed treatments that we do. I will talk about treatments that I have done. This is me prior to having any work done. I was 28 years old here. I am now 38 years old. I have 3 babies and I am still breastfeeding, and they have sucked the life out of my face. That is what I noticed after breastfeeding my oldest, he's 11. Okay, so if you have questions, let me know. In the meantime, I will talk about, again, the natural filler and our skin treatment. So I told you a little bit about the natural filler. That one, when we're doing this, you want to come in and do a minimum of 2 sessions, maybe 3 sessions, really depending on your age, depending on how much volume loss or sunkenness that you have in your face that we're trying to address. Common places people like to use the natural filler is underneath their eyes, into their smile lines, into their cheeks. Other areas, you can treat it anywhere in your face. So people will do their temples, their chin, jawline, the corners of the mouth, the marionette lines, their lips. So you can use this anywhere in your face. Patients really love the fact that nothing else is mixed inside the tubes. Nothing else is mixed inside of this. It's only made from your own blood. So we do blood draw from your arm. We spin it in the centrifuge. It separates out your plasma, your growth factors, and stem cells. We take that part, we heat it and cool it so it thickens into a gel. And then we can inject this anywhere in your face. And like I was mentioning earlier, wherever we inject it, your body's going to make new collagen in that area over time, which is really great because we start losing collagen mid-20s, and collagen is it's like the building blocks to our skin. It helps things look lifted, youthful, bouncy, and we're losing this. People love the natural filler. They will come in on the same day and do it as the skin treatment. So I mentioned those earlier. I will talk about each of them in our office with the Aerolase laser. This one has no downtime. Anything I talk about is going to be safe for all skin types, all skin tones. So we see everybody in our office, all ages. We see males, females, we see everybody. So the laser, no downtime. This is really great. I think a highlight of it is it's so excellent with treating acne, inflammation, killing bacteria in the skin, redness. There's over 36 different things that the laser can treat. We also use it for hyperpigmentation, which is dark spots, hair removal, the flat moles. I had a bunch of them, we call them DPNs. I had a bunch of them all over my neck and my face after one of my pregnancies, and I love the laser. Someone said, what's better, Aerolase or PicoSure? I was looking at both of those when I decided going with the Aerolase. It depends on what you're trying to do. PicoSure is really for pigment, whereas Aerolase, you're going to be able to get pigment plus working on acne, hair removal, fine lines, texture. So that's why we go with Aerolase. Our patients love this. You can combine it the same day with any of our skin treatments. Most of our patients are coming in and doing multiple skin treatments on the same day. I'm 19. Will my face fat actually go away as I get older? Yes, it totally will. I remember in my early 20s being like, oh, I want to get that surgery where they suck the fat out. Don't do that. You're going to naturally lose some facial fat into your later part of your 20s. And that's where people will start feeling like their face looks a little bit more snatched. They can start seeing some of that, structure change with the facial fat. Okay, so Aerolase, love it. You can do this on a monthly basis. If you are coming in to treat acne, cystic acne, redness, inflammation, we might be seeing you a little bit more frequently. You can come once or twice, like once or every 2 weeks. But most patients will be coming every 2 weeks for acne. We see them for about 2 to 3 months. And after doing that, they start noticing a huge reduction in their acne. If they're even having breakouts anymore, they are few and far in between. They heal a lot faster. They're not as inflamed. So patients really love that. Okay, I'm going to answer some questions and I will keep going back to talking about the rest of the skin treatments, but we just talked about Aerolase and that one, again, love it. So A Queen says, when do you start seeing results for EZ Gel? You can see those very soon. If you want to see a little bit of like the initial lift, you can see within the first few weeks, but the collagen stimulation can take up to 6 months to see. The healthier you are, the better your outcome. So this is going to depend on you and your lifestyle. If you are smoking, drinking, drugs, having a poor diet, poor nutrition, like your body's not going to be able to make collagen as well. So we really encourage patients eating healthy diet, healthy lifestyle, taking vitamins when they're getting this. Most patients will be able to see something between 1 to 2 months after their treatments. It will progressively get better 4 to 6 months later. So patients really like that one. I love it. I've been doing it the past 2 years. I haven't had any regular filler in my face for over 3 years. I was pregnant. I'm still breastfeeding this baby. He's 2. And when I very first did the natural filler, I was like, I don't see any change. Like I'm used to seeing instant result when it comes to filler. I've done a bunch of filler in my face over the years. So when I did this, I was like, oh, I like it initially. And then it looked like it didn't do much like a couple weeks later. Just remember that your body has to make collagen. So it got better over time where I was like, dang, for not having any filler, I'm now 10 years older than this picture here. I haven't had filler for 3 years. I'm breastfeeding this big baby and I'm surprised he hasn't walked down the door yet. And he eats food too, guys. So I don't know why he needs to eat a hamburger and breastfeed, but he's doing that. And I'm like, the fat is not getting sucked out of my face to where I look back to this. Now, my first 2 pregnancies, I look like this. And so I use filler after them to like restore that volume. This time, this one is just made from my own blood and my own plasma. I've been doing it and I'm like, I don't look so sunken because I've been using the natural one. So it gets better over time. Even for the patients that are like, I don't see it. They tell me this like after the first one. I'm like, I know, give it the time. Guess what? They always come back. They'll come back like 9 to 12 months later. And I'm like, oh, you're here to do this again. Like, what's going on? And they're like, I saw it. I saw it. They're like, it was 4 months later. It was 6 months later. So just know it gets better over time. If you want really like structured, like for guys, if they're like, I want super chiseled jawline, I'm like, it's not going to give a ton of structure. That's where I would go more with filler. When it comes to filler, I can pick and choose different ones based on your skin and your goals, but it's not going to be super chiseled. That's something to keep in mind. But I think for volume loss, I think for soft contours, it is very nice and our patients love it. We do it on all ages, all skin types, all tones. Alicia said that's what she needs. I think you're going to love it. Yeah. Pamela said, I have hollow under eyes. I tried filler and PRP and nothing works. What do you suggest? I would need to see your eyes a little bit better. Let me see if I can see your picture, Pamela. Oh, I can't make it bigger. How many sessions of PRP did you do? And when I talk about PRP, so I know I'm talking about EZ Gel, a lot of people will tell me I've done PRP, but I'm like, hold on. We're not just doing PRP here. Remember, I told you that we're taking it and we're also heating and cooling it. So thickening it into a gel. That heating and cooling process of your growth factors and stem cells helps those stem cells stay in the skin longer for like up to 3 months. Whereas if you just do regular PRP, it's only going to be in your skin for a few days. So you have longer exposure to it, better chances of your body making new collagen. That's what I would say. Filler, I also would have to know a little bit more. In order to do filler, you got to be the right candidate for it. You can't have a lot of water retention around your eyes. Anyone with bad allergies cries a lot. They wake up in the mornings, they're puffy. They always notice their eyes go up and down. Not candidates for under eye filler. Filler binds water. So if you do filler and you get puffy, it's going to look worse. So that's something to keep in mind there. You can do the natural filler. You're not going to have issues with it swelling up and down. So that's something to keep in mind. Pamela, I also just need to know, like, I just need to see how much did you do when you did your filler? How much did you do when you did your PRP? If you did 1 syringe and you have really sunken under eyes, that might not be enough. If you did 1 session of PRP, that might not be enough. So I just need to know a little bit more about your story. When I do under eyes with with either of these, filler or the natural filler. I do it in a minimum of 2 sessions. With filler, I got to be really precise. And not just me, guys. When I say me, it's me and my team. My team is excellent. I know a lot of people are like, I only want to see you. I'm like, y'all, the team is excellent. So anyway, when we do filler underneath your eyes, we got to be precise. We don't want to overfill or it's going to look pudgy, like it's going to look bad. You don't want that, and it is noticeable. You don't want these little like, I see it on people sometimes. I'm like, what are you doing? Dissolve that. Anyway, you don't want it looking overfilled. So when I do under eyes, my team and I do under eyes, we do it. We say, let this settle for 6 to 8 weeks. It takes that much time for it to integrate, mesh in with your skin. After that point, come back. We can fine tune if we need to. If it's perfect, we don't have to add, but we give that second appointment just because when we're injecting you, you can bruise, you can swell. That's going to give us a false idea of what the actual outcome is because you're bruised and swollen. So we need to see you once it's settled to see if we need to add more. So that's with filler. With the natural filler, the one made from your blood, we also do that in a minimum of 2 sessions. We want you to come back for this one, like 1, maybe 2 months later, to retreat the same area. For that, we're trying to stack those growth factors and stem cells to give your body the best chance of producing that collagen. So either of those, you're going to do it in 2 sessions. Natural filler, you can do more if you want. So Pamela, I just need to know more about your story. If you guys have ever done a consult with me, you know I ask a lot of questions. My team, same. We just ask a lot of questions so we can make sure we know your history and make sure that if we're making any recommendations for you, that they're the right ones. And everything is going to be pertinent to, it's going to be like specific to you. Okay, it says I have 21 messages. I should read these. Thank you, Alicia, for the love. Okay, let me see. I got chin lipo in February and have loose skin in that area now. Would radiofrequency microneedling help? Nita, I am not like the hugest fan of it. I mean, like if you do, I don't even offer it in my office because I feel like results are mixed from what I have seen. I've worked with the devices in different capacities over the years. I've been doing this since 2013, so almost 13 years as a cosmetic nurse practitioner. I don't know. I feel like back when we would be doing this, never in my own practice, but like in practices I've worked at, the patients, it would be like so hit and miss on the results. And sometimes they didn't like it or it felt like they got rid of more fat. And so I can't fully stand behind it and give you that recommendation. If that's something you want to explore, I just tell patients like, do your consult with somebody. Make sure you see a lot of patients that look like you, multiple before and afters. Who is this person doing it? Like, obviously, are they licensed? Do your consult and just see what's realistic. So I don't really think it's going to do much, but I don't offer in the practice. So I encourage you to talk to somebody who does, and just make sure they're an expert at it. For loose skin after there, if it's the neck bands that are showing, I'm kind of flexing my muscle now. If it's that, Botox can do a little bit to like help tighten. People do like that through the neck, but if it's just like, it depends on how much loose skin. If it's just skin, it might be a surgical surgical is going to be able to give you the best outcome. Okay. Come to Dallas, Texas, please. Tina, I used to live there when my husband was doing dental school. I worked at Parkland and that was my first job when I was finishing up my nurse practitioner school. So I see a lot of patients out of Houston and Dallas. That is probably like the highest amount of patients I see, like outside of LA. Every time I'm in clinic, we see people from all over. Today, my consults, even patients were from Seattle, like all over. Somebody else was from Massachusetts. So I see patients everywhere. I have my license, my RN license in Texas, but I need to get my nurse practitioner license. They wanted me to take like a Texas history class. And I was like, guys, I've been doing this for a long time. Okay. Latasha said, what do you think about liquid lipo for the chin? So Kybella is what we have FDA approved in the United States. Kybella is a permanent way to dissolve fat cells. I reel with patients with this all the time. Like, Kybella works. It takes multiple vials. It takes multiple sessions. So I'm like, if you're going to do it, you got to commit to it. And it most of the time, it takes people about a year to get to the results because you got to think, you got to do 3 to 4 sessions of this. You do the sessions about 2 months apart. You're going to be doing anywhere from 2 to 4 vials per session. It depends on how much fullness. Sorry, I was marking on my face and hands for a video earlier. How much fullness you have underneath your chin. When we inject this, the medication is dissolving the fat cells right then and there. So you will feel it kind of sting for about 5 minutes, and then it feels really heavy and it looks like a bullfrog. It looks like a triple chin. It looks like Nutty Professor. It is noticeably swollen for about a week and a half. And so the thing is, people don't like the downtime of it. So they're like, oh, this looks crazy. I'm like, yes. I'm like, I'll see you in 2 months. And they'll be like, 2 months is Valentine's Day. I can't come in 2 months because I'm going to look hot on Valentine's Day. I don't want to be swollen. So then they push it back another month. And then I say, okay, you come after that month. Like, oh, now 2 months again to do your third session. They're like, oh, but it's my birthday. I don't want to be swollen. So that's why I'm saying it can take a long time. I tell people, I'm like, if you're open to surgery, they can suck it out. I'm not a surgeon. So I highly encourage you to get a consult with a surgeon to tell you if that's the right treatment for you. But the patients that do Kybella, they like it if they can understand we're going to be seeing each other for about a year. You're going to look crazy for a little bit, wear some turtlenecks. So that's just something to keep in mind. They end up doing, 9, 11, 13 vials of it. So sometimes it becomes like the cost of this. Like, do you want to do that or do you just want to do surgery? That's what I think about. Okay. Alicia, that's what I think I need. Under eye. Where in LA are you? So our one clinic is on National Boulevard in Mar Vista, so outside of Culver City, and then in Torrance. So I got 2 in LA. I've been in LA my whole time I've been in LA. I've been practicing as a cosmetic nurse practitioner. So this is all I do. And then I've just opened an office in Las Vegas on the Summerlin side. Okay. Hopefully I'm getting these questions. We said that one for Pamela. Okay. I got that. And then now I'm going to go. Oh, somebody said about EZ Gel. Does it volumize? Oh, I'm trying to read them and go up and down. If I miss yours, please just say it again and I will do it. We said the liquid lipo, but I was trying to read that one. Can you use EZ Gel to volumize the lips and cheekbones mildly? Yes, I put it in people's lips. It's not going to give super crispy defined borders. And for the cheeks, yes, for volume, not for oh, I want super snatched. It's not like that. A little bit softer on the contours is what you want to keep in mind. Jaw lines, it's not going to be it's going to be a little bit softer on there. Okay. Mia was saying the cost, let me see which one. Maybe she's meaning of EZ Gel so EZ Gel, the natural filler, if that's what you're asking for the cost of. It's $2,550. That covers 2 sessions. Those 2 sessions, when we do the blood draw and we get the spin, how much we get out of that is about 5 syringes worth. So 5 syringes, we can go anywhere in your face where you want. Most of the time, a lot of people want to do their under eyes and their smile lines. If their under eyes are super hollow, I might be putting all 5 underneath. If they're not that hollow, we could be doing eyes and then some into the smile lines. Some people will come in and be like, I want to do my eyes, my smile lines, my cheeks, my temples, my jawline, my chin. They're doing their whole face. Instead of drawing 2 tubes, we draw 4. I think the price to add on, to do 4 tubes is $350 a session. I'm not 100% sure. We have all the pricing online, guys. Also, I try to be super transparent about everything. I get people what is this? What do you do? How much does this cost? I try to put pricing up there, but still you might not know what treatment is right for you. So this is where I encourage people, set up a virtual consult. We can talk through your questions, your goals, tips on what to expect, how to prep for treatments specific to you, and start building out your treatment plan during that call. Almost any patient that I see, 9.5 times out of 10, we do a consult before just so we can start setting it up. Again, I'm seeing people flying from everywhere because of social. And I want them to be able to be prepared. I want them to make sure the timing is right, that they have the downtime. If, the bruising and the swelling is not downtime, but you can be bruised, you can be swollen. Are you trying to prep for an event? I want to make sure that we have enough time before your event to get you to the results we need. All the things. I want you to stop drinking alcohol, stop taking blood thinners, eat arnica, take pineapple, little things like that. Okay. Hi, does PRP work for rich auntie alopecia? Yes, it does. And you can come in and be seen by our dermatology nurse practitioner. We have Niani, Black dermatology nurse practitioner. I say that just because there's not a lot of women of color doing that, and she's excellent. You can see any of our team. Everybody, but I'm go see Niani because she can start looking and say, hey, make this recommendation. Lisi, or at least once. She's excellent. In the office for hair loss, hair thinning, and we treat people with, there's different types of alopecia too. So we kind of have to know more about your story and what's going on. But we have an entire hair health program. We have a scalp detox facial. You come in, we're declogging the follicles from oil, sweat, anything, any debris blocking the follicles where your hair cannot grow. So we're declogging that first. Then we draw blood from your arm, spin in the centrifuge, take out those growth factors, inject it into your hair where you're noticing the hair thinning, hair loss. That's going to help promote hair growth. Also, during the scalp facial, we do red light therapy, a scalp massage. So people love that. They just think it's like relaxing and nice. Then at home, we get you set up with some supplements. And if some people want prescription medications, oral and or topical, so we can help prescribe and dispense that through the office or get it compounded depending on what's going on. So yes, we have a whole hair health program. This is good for males and females. We see a lot of men in here for that. We see all hair textures, all skin types, all skin tones. So we see everybody like, can it work on straight hair, curly hair, nappy hair? It's going to work on all the hairs. And we have different pictures to show that, and patients really like it. I would say you're going to want to do, it depends on how much like you're noticing the hair thinning and loss, minimum of 3 sessions. If it's like, oh, I've been noticing this for a long time, we're going to be doing 6 or more. Also, we're really big on talking to you about your lifestyle. What is causing the hair loss? So sometimes people are like, I see a lot of girls in my office, like, it's my braids, my weaves. I'm like, hey, we got to figure out something else right now. Because if we keep having the same stressor on the hair and the hair follicle, this is not going to work. Like, I don't even want you to put the money towards this because we got to stop it at its tracks. One of our patients, lovely, and he did the whole hair program. He did it for like 6 months, but he was bleaching his hair. And so he's like, I had to stop that. He was like he was noticing also, hair loss through the middle. He's like, this is after my dad. Genetically, my dad has it. But once he stopped that, he was doing the hair program. He's like, I used to get my hair cut every 2 weeks. He's like, I have to go every week now. He's like, my barber is like, what is going on? So it's just cool to see it. By month 3, people start getting excited. They can see the little baby hairs. 6 months in, they're like, whoa, it's like a big visual difference on before and after photos. Okay, sorry guys. You see, I answer one question for like 5 minutes. I just want to explain everything. Can you wear wigs during the process? Yes, you can. And like people will do braids, but they just won't do them like super tight. But yes, you can wear wigs. Totally. Can lip fillers or Botox change a downward smile? Jackie, yes. So if you make that face, you can do Botox here at the corners of the mouth. That'll help prevent that downturn. If it is like at rest, you're not even making a sad face, but like you have like deep little marionette lines right through here, you can use filler or the natural filler to help soften the shadow or the line. I tell people we want to be careful that we don't get it too full right here, or it'll look puffy and look weird. Okay. Hi, RN, do you allow people to shout at you for Botox? I used to do like a whole mentorship program for like 6 months and helping people get started and start their own practices. Right now, I've just, like anything I do, guys, I'm doing it to 5,000,000%. Right now, I just don't have the time. You can message me, like the ones that like keep messaging me. I'm like, dang, I gotta just like let them come. And then usually that's how I end up finding the team members that join us. Like they come and I'm like, I like you. We just really go off of, like, are you going to vibe with our team and the patients, and you're going to be able to serve these patients? We see people from everywhere, all skin types, all skin tones, all the backgrounds, rich, old, young, old, like we see everybody. And like the team is so special. If you have come to the office, and like read the reviews, guys. It's not just take my word for it. I'm like, read the reviews, look at the patients posting their own videos. I see so many like big creators from social that come in and like they trust us, and we're just here to like serve. We're here to work with you. What we're not here to do is like be pushy. We're not here to be like, you should do Botox. That's not it ever. Like usually my patients know a lot of times they're like, no, I don't know if you need that. Let's pause or let's rethink about that. We really just want to make sure treatments that we're doing, you're informed about them. They're the right treatment. They're going to serve you and like what your goal is. And it's a treatment plan we develop that may change over time, depending on what's going on with you in your life. Sometimes people are coming in, and they're trying to work on scarring, but if they're still breaking out, I'm like, oh, before we can do the scars, I got to work on, the acne. So it's always a constant communication. You see, I talk a lot. Same for all the team members, because we just want to know about you. We want to make sure like this is going to fit you and your life and all of that. Okay. I got Botox for the first time 2 months ago and it's already worn off. Kat, is it normal? Possibly. So Kat, it's hard to know without knowing your dose and the areas you treated. And that's the biggest thing. So when it comes to Botox, guys, How much we do really depends on how strong your muscles are, how big the area is that we're treating, and then what you want the outcome to be. The more we do, the more frozen or restricted it is. The less amount that we do, the faster it wears off. So sometimes people will come in and they'll be like, oh my gosh, I'm nervous. It's my first time. I just want baby Botox. Do the lightest amount ever. And we're like, okay, you can totally do that. And they're like, oh my gosh, I like it. But they're like, oh, why am I moving again in 6 weeks, 8 weeks? We're like, well, we did a really light dose because you were really nervous. So that's something to keep in mind. And it's totally fine. The biggest thing is that you communicate with your provider and also know that what you like may change. You might have thought you wanted to go baby Botox and then you're like, oh, actually, I don't really want to frown. Like, I don't want this to last longer. So just communicate with your provider. Easy to adjust dose. Every single time you go into the office, it's got to be a conversation. So even my people I've been treating my entire career since 2013, routinely, I don't just like, hey, let's do the same thing we did. I'm like, how was that dose? Oh, you usually come at 4 months and now you were out of the country for a while. You came at 8 months. Oh, that dose might be different. Oh, you are now taking a weight loss medication. Your metabolism is faster and you've been working out more. You're going to metabolize this faster. That dose might be different. Oh, you just got booked for this acting job and you actually need to like be a mad cop. That dose might be different. So it's really important. As you can see, everything is going to be customized to you and your face and like what's going on. This is why we ask questions. This is why you have to have an active voice in getting your treatment. And so I know not every person can come to see us because I'm seeing people from all over the world talking to us on here. It's like, I highly encourage you, like, talk to your provider, ask questions, ask them why this, why that. And they should have a reason. Like, there is a lot of thought behind each and everything that we do. It is not random when it comes to your face, and nothing should be random when it comes to your face. And you can't bring me in your twin sister and your mama and your best friend and say, well, they got that, so I want the same thing they did. I'm like, I got to go through like a list of questions to make sure that whatever is going to serve you. Guys, I see so many questions. I'm going to try my very best to answer them. I also am going to have to go soon to get my kids. I was an aesthetic injector for 6 months with a company that rushed the trainings, left because it was sketchy. Brittany, good job. Protect your license first. That's like the most important thing. That's important. Like I said, I've been in a long time. A lot of it might come down to you having to study, having to go to several trainings. Like, I used to go to so many trainings, but it was like afterwards, you got to like kind of stack up your models and like practice, and then you got to study, bring them back in, get their before and after photos so you can study and be like, how could I have done this better? Ask them for feedback. Because your patients are the ones you're going to serve. Like, you want to know. I still ask my patients. They know. That's what I'm saying. You guys got to tell me when we're meeting you every single appointment. Give me feedback. Like, the more I know, the better I can serve you. That's what it is. Okay. I wish mine had that conversation with me. I got 30 in the forehead. Likely wasn't enough then. Yeah, Kat. Like, it can be so different. I know I'll make videos on here and say, here's what like this many units looks like. But guys, the units changes from person to person depending on what's going on. And it could change for you from one appointment to the next, depending on what's going on. So like, what is FDA approved when they ran these studies to say, here's what Botox is for people with moderate to severe, moderate lines in their frown, they said 20 units. And they said for moderate lines in their forehead, they said 20 units. Around the eyes, it's 12 units per side. Like, that's what's FDA approved. Now, I have talked to the men who were like the developers of Botox. I've been in this a long time, so I've gone to a lot of things. And like old white men. And they're like, yeah, when we were doing the studies for the FDA, like it was the beginning. Like, we just picked a number and we didn't know. So like 20 was just like the number. And everybody is kind of based, more or less 20 in your frown off of those numbers. They said they randomly chose and they said like it worked. And we saw that it lasted for 3 months. However, in our practices now, we do triple that amount and we have found that it can last people 6 to 7 months. I do 5 times that amount. I have on myself, but I'm saying this is what the old white men were telling me. Old white doctors are like, I've done 5 times the amount in the frown. I've done 100 units on my patients. And they're showing me all these before and afters. Like, it lasted a year. So that's just something so you guys can know. It's like your number is going to be different from your best friends. And it may be different from time to time. We just have to adjust it based on you and your face and how you present in that moment. And don't just be like, I always get 40 units. I mean, that's cool if your injector just does the same thing every time. But like, is it cool? Like, no, your face changes and like your concerns may change. This is why we got to communicate. Sorry, I'm going to try to answer all these questions right now. I got to go through these. I want to be able to see my jawline and have a chin. Do I get Botox or filler? I have no idea. I got to see you at baseline. Lovely. Let me see if I can see you. I can't see you because you're blocking the picture on your profile pic. If you can already see a little bit of your jawline, filler is going to help add like some contour, some structure there. If it is like I have no chin, like no separation from my jawline to my neck, it's just like really full, you might not want to do filler because it's going to look too wide. It's going to look too boxy. Guys might want that, but girls don't want that. So I have to kind of see what it looks like baseline into the neck. Botox will help tighten some of the neck bands. And so when these are tight, sometimes, it can give a little bit of definition along the jawline. So it could be one or both. I don't know without seeing you. Okay. I'm 19 and I really want some fillers, but I'm scared I'm going to look weird in a few years. Don't do it. Just wait. Like you're a baby. Your face is going to change. Stop it. I will say at like that age, girls will come in for like lip fillers. I get that. I mean, honestly, if you're going to do anything, skin treatments, but really start using your retinoid, sunscreen. Filler at 19. Like, I mean, really that's just lips unless somebody's like here and there. I've had people with like different genetic disorders where they're like really hollow. You can try, the natural filler or regular filler, but 19, your face is going to be changing. Maybe lips. I get that because people want that. I'd be interested in the mentor program if I ever bring it back. Oh, thank you. I know. It just takes all my effort, all of my thought. And the girls are doing good. The ones that did it, they've got their practices going. It's really cool. But if you ever do have questions, you're just like, I got this patient, I don't know what to do. Just text my number on the team. The team, we'll make sure. I don't want to leave you hanging if you're like, oh shoot, I have this patient. What do I do? Okay. Hey, I'm from Richmond, Virginia. I own my own med spa, NP, doing Botox, microneedling, and hey, CKE, I hope you're doing so great. And I love seeing women of color in this. It's just really fun to me because when I started out in 2013, I could count on my hands how many women of color as patients that I saw over years. I saw 5 over 8 years. I was like, I don't see any black people here. Anybody else? That was one thing, but I was in Hermosa Beach. And seeing providers of color, it was not seen. I'd be going to the conference. I'm like, I don't see anybody else here that looks different. So it's really cool to see the aesthetic industry has really brought in more people. We need more people of color. We need more, just diverse backgrounds, just everybody in there, males, females, just diverse backgrounds, because I want people to be able to look and feel safe and seen and heard and beautiful, and just they can be themselves, and that this person is going to understand them maybe because they look like them or they have similar features or the background. So I hope you're doing awesome. Okay. In LA, which building do you go to for the alopecia? Any of the offices all have the same treatments. So Torrance, Los Angeles, which is in Mar Vista, or Summerlin on Vegas. Thoughts on Botox not lasting as long as it used to? I know, I've heard that a lot from, I feel around 2021, with the COVID vaccines, I started hearing that. I haven't really heard that so much anymore. For patients that have done Botox consistently 8 to 10 years, every 3 to 4 months, I used to hear oh yeah, it does not work as well. We'd switch them over to a different brand. There's Botox, Dysport, Xeomin, and Jeuveau. What else we have? Daxify, Ledi Bobo. So those are the FDA approved ones. I do think if you've just used Botox for a long time, maybe try a different brand, and yeah, maybe take a break from it for a little while and give your muscles a rest. It could be that. Okay. If you are nervous, can you just do a filler each month until you achieve your desired results for energy? Okay. So when I do so if you're nervous, I would say try the natural filler. It depends on what you're talking about. I need a little bit more background energy, about what area you're thinking about. You're thinking about the lips. You think about what are you trying to accomplish. We don't really want to do regular filler every month in the same area. When you do your filler, we got to wait 6 to 8 weeks to let it settle, then reassess to see if we should add more to that area. If you're going before then, that product has not settled and you have a way higher chance of overfilling. So I wouldn't do that. If you're nervous, I think a nice way to start is the natural filler, because you're not going to lose. You're going to get some of that collagen stimulation long term, but 2, it's not going to be overfilled. It's not going to be weird. It's made from your blood. You're not going to have any reactions to it. It's not going to leave lumps and bumps. Like, it settles so nice. But a bigger thing is, like, you can also kind of see what a filler result could look like. You can kind of see yourself swollen. And so you can be like, oh, do I like this swollen? Do I like this when it's like in this lifted state? And then decide from there if that is something that you want to do your regular hyaluronic acid or calcium-based filler on. So that's what I would say. Also, just don't rush. If you do decide filler, don't rush getting it in the same area. Other things when it comes to filler, guys, is we don't want to spot treat. And so you don't want to just be like, oh, I just want my smile lines and only my smile lines. And like, if it's your whole face is aging. And so like, what is contributing to the smile lines getting deeper is that volume loss through your mid face or your temples. Like, we got to look at the full face, not just chase a line, not just spot treat. When people spot treat, you guys have seen them. They look crazy. They look on the streets and you're like, oh shoot, I can tell she got her lips done. I can tell she got her cheeks done, because that's the only thing on their face that looks done. And then everything else looks off. It's like saggy. It's like untreated. Like, that looks weird. Big lips, sunk, cheek, chin is like recessed, sunken corners of the mouth. It looks bad. You don't want that. No smile lines, but like cheeks are all saggy. Like, it just looks off. So that's something to think about. Okay. 41 messages, guys. I'm hoping I can get to these. Okay. I'm really considering Botox or filler, and I live in Vegas. Aja, I would love to see you. I'm going to Vegas tomorrow. I go to Vegas like once a month. But we have an amazing team. We've got Samantha there, Karina, Alexis. They are excellent. I love Samantha. I'll be seeing her tomorrow, and so maybe I'll try to go live with her if we can get some time. But yeah, I go out there. I'll be there tomorrow. Okay. How to get natural looking volume on the front of the cheeks. So filler or the natural filler. Remember, natural filler is going to happen over time, gradually, or a little bit of filler. You don't want to build up too much here and then just be cheeky here. A lot of people do that. Oh, I want the apples on my cheeks. I'm like, that now looks really weird. And then this is sunken. So yeah, but it's like the placement of it. When we inject, me and my team, when we inject, we are not just thinking about what I can see right here, the lines, like right here. We are thinking about the anatomy, what is going on beneath the skin, how the face is aging, where fat pads start to separate, so they get a line through here, where they start to sink, where we start to lose bone over time. And so that's what drives us on our team when we're injecting, so that it doesn't look weird. Like, I don't want you to look weird. I don't want you to look like you've had anything done. It needs to just look fresh. It's not going to be this thing that people can clock that you've done something. That is the whole point. Like, we don't want them to be like, who did your smile line filler? No, that's not it. They need to, like, I ask my patients, I'm like, what are your friends saying? What are your people saying to you? I'm looking online. I'm reading the comments of my creators that I'm treating. And like, nobody's saying anything. Like, whoa, did you get a new lip gloss? That needs to be the question. Did you change your hair? Did you change your makeup? Did you go on vacation? Because you just look rested. You look refreshed. Something they cannot tell. They cannot detect where you did the filler. That's the whole point. Okay, what about my nose to decrease and structure it? So for nose, we can do filler. Usually, guys, I'm like flipping through photos. I just did not set them up. It takes me some time to like set them up so I can click through here. But I have you can actually go on the top of my page. There's like one that says nose filler, and I don't know what it is, where I've like grouped a bunch of before and afters of noses, and you can see that in videos talking about it. But with nose filler, we can camouflage a bump, we can lift the tip of the nose, we can create like highlight and structure down the center of the nose, minimize like asymmetry. So some people, like, their nose will kind of look like their highlight will kind of turn that way. We can make it look straighter. On the nostrils, we can make them more round or more triangular. Like, people have different requests there. We can make the nose appear slimmer by building up the bridge, but it's not actually pinching the nose in. We can do Botox along the nose to help with like these bunny lines, to help with nasal flaring. Some people like do like that, and so their nose looks a little bit wider. So when we Botox it, it'll help the flaring not flare so much, and then it looks thinner. Can also use Botox to help prevent like the nose from kind of like twitching. Some people, when they smile, their nose like kind of goes down a little bit. So we can kind of stabilize that with Botox. We can do a lot. I mean, go on the page and you can hit that nose filler and see, like, I feel like we get like surgical results with nose filler without having to go through surgery. Like, you see the result right then and there. When I do nose filler, we do it in 2 sessions. Do it. You know me. Let it settle. You got to wait 6 to 8 weeks. It might swell. Come back. We can fine tune, build on that foundation, add more if you want, if we need. If it is perfectly straight, I mean, you got what you want and we don't need to. And not everybody wants it perfectly straight. Let me say that. Some people tell me, Ginille, I don't want to get rid of my bump all the way, but I want to get rid of it some. And some people end up changing their mind. Later they come back and they say, actually get rid of it. So that's the cool thing. You can do it. You don't have to have downtime with it. Surgery, like when people do those, there's downtime. And then they're telling me, I got to wait a year to see my full results because I'm swollen. I'm like, a year? Like, no, we can get results right now, which is really nice. Okay. Leonie said, what happens with hooded eyes? I'm considering getting it. I don't know what you're talking about, considering getting possibly Botox maybe. So hooded eyes, surgery might be the only thing to just get rid of skin. Surgery is the only thing to get rid of skin. If you feel like you have low leg brow or low lids, you can do Botox along this muscle. So this muscle is a circle. It closes in like that. So when we Botox, instead of it forcefully closing in so much, it's going to give you a little bit of a brow lift. It's going to help minimize those crow's feet. It is not this. It is not an extreme brow lift. It's not that. But people always like, oh, like things look a little bit more lifted. So you can try that. And people like it. You know, that's like a non-surgical route. Some people are like, I want to try this before I commit to surgery. So you can check that out. I got 45 units of my masseters. Feels like it wasn't enough. Yeah, that's on the lighter. It depends. You per side, or did you do that total? So usually when I'm doing masseters, I start 20 to 30 units per side. Let them tell me what's going on in 2 weeks. We got to reassess those symptoms. So when we're deciding to do TMJ Botox, this is for people that have clenching, headaches, teeth grinding, jaw pain. Anybody like suffering through TMJ symptoms, this can help relax this muscle from overuse, and then they get relief from their symptoms. Sometimes I'm treating into the masseters only, or I might be treating into the temporalis muscle, the temple muscle as well. Both of them are chewing muscle. So both of them are active when you're chewing. Sometimes I have to relax one or both of them. Sometimes the dose is different from one side to the other side. Depends on what's going on. It can slim your lower face. If your face is wide from overuse of this muscle, if this muscle is always bulking out, it can slim over time after that muscle is relaxed and not flexing so hard. So 45 units, I don't know if you did that on one side or both sides, but you probably did it total. 20 to 30 is what I'll start per side, and then we reassess after it kicks in 2 weeks. I say, okay, you told me you used to have headaches 5 days a week, a scale of 8 out of 10. What are your headaches now? Oh, wow, you're only getting them twice a week, and it's a 3 out of 10. Cool. Oh, it's worse on your right side. Do we need to add more? So it can be adjusted. You got to talk to your provider. I think this is the same one I've been talking to earlier about Botox dosing. You just got to communicate with your provider and make sure they are like listening to you and including you in the conversation, not just randomly giving you units. They got to be looking at your face. Okay. Sorry, I just got here. I'm not sure. You already said, but what have I gotten done? Oh, there's a whole video on my page about this, but this was when I was 28. I'm 38 now. I need to obviously wash my hair. I need to go see my kids in five seconds. I need to pull myself together. But after breastfeeding, my first one sucked all the fat out of my face. I have 3. And I breastfeed them all for like 2 years. And so I got really hollow through my temples, my under eyes, the cheeks. I didn't get that little dent there. I did regular filler underneath my eyes, temples, cheeks, chin, to elongate my jawline. I've done Kybella to dissolve fat permanently underneath my chin. I've done Botox my whole face, frown, forehead, like all the spots. I've done it. I've done all the things. Because I'm breastfeeding, I can't be doing stuff because I got that baby. So I've been doing the natural filler. That's the one from your own blood and plasma. Nothing else is mixed inside of it. I've been doing that the last 2 years. I've been doing skin treatments. I really love the Bio Repill, the Aerolase, the Hydrofacial, microneedling. I don't love it as much as the other ones. Relative, like to some patients, that's their favorite. For me, just because of the downtime, and I'm having these little kids with their dirty hands touching my face all the time. And I'm forward facing with like patients and having to wear a mask. Microneedling has a little bit of downtime. For me, that's the only reason I don't like it. A lot of patients, that's their favorite one because they can see quick results, the best results on texture improvement. But yeah, I've been doing skin treatments and the natural filler the last 2 years. Before that, I've done filler my whole face, all the things. It's just been 3 years since I've had filler. I love it. I love filler, but like the natural one has held it down. I'm happy. I don't know if I'm going to go back to filler because like I like what I'm seeing. Okay, I hear these kids. I'm going to do, in 5 minutes, I'm going to go. Okay, how long would you say it takes to see results with Kybella? It takes a while. That's what I was saying earlier. I was like, if you want to do lipo, it's faster. I feel like by session 2, they start to see a little bit. By session 3, more. But remember, multiple vials, multiple sessions. If you're like, somebody earlier today was telling me on our consult, she's like, I did 1 vial of Kybella. I was like, I know you didn't see anything. She's like, I didn't see anything. It takes a lot. It takes like multiple vials. So just keep that in mind. Do I have smile line filler? No, but I have the natural filler in there. So the growth factor one. Smile lines, like I try not to get these all the way gone. I think a lot of people will chase like, oh, well, my smile line's all the way gone. I'm like, their faces end up looking a little weird. So I try to keep some of my smile lines just because I don't want my face to look like too pudgy. Like if you have no line here, this is blown out, it could look really full. Also, don't try to chase to get your smile lines all the way gone anyway, guys. It's just not it. If you do that, your face could look blown out. And we're still going to have lines because we talk and we move and our face smiles. So it's just something to keep in mind. Nurse Kells, he said, I have tried fat transfer and filler twice. My eyes still look like that with the line underneath. Send me your thing, Kells. Fat transfer, I know sometimes they say that it doesn't like take all the way. Is it when you smile that there's a little line? Is it from like maybe it's a muscle thing where you can do like a couple drops of Botox? So let me know. I just kind of need to see. You can send me pictures or send me a quick video. Benny, what's the natural one? The natural filler is made from, we draw your blood, we spin it, separates your growth factors, your stem cells. We take that part, we heat it and cool it so it makes a gel. So we use this as a filler alternative. The whole intent with this is not really for an instant fill. This is for your body to make new collagen wherever it's placed over time. So it just gradually, progressively gets better. It can take up to 6 months to see the full results. You want to do a minimum of 2 sessions, mid 30s plus, maybe 3 sessions, or depending on how much volume loss you have, you might be doing, 3 sessions. Okay. Thank you, Orange. That looked great. Thank you. Oh, so Celeste was also asking about the natural filler. Queen said, how do we book with you specifically? I don't see it on the website. I know because I virtual consult everybody because I got to talk to them and like build out this treatment plan. Really, because I'm seeing a lot of people that come from outside of the state and outside of the states. I'm prepping with them and like getting them set up for when we meet so that we can have be ready for your appointment. I don't want you to come in and be like, oh, I'm randomly going to pick and decide. No, I want you to be informed. We make informed decisions. We build out that treatment plan. You get you started on your pre and post, like get you started on the pre-care. We make sure the date is right. We talk through all the stuff. So yeah. And then when patients are coming in, like we're doing the whole face. We're kind of like doing the face or we're doing like multiple things in one. So I'm kind of just prepping them with this. You can do virtual consults with me or Samantha. The whole team, guys, you don't have to just see me. Like the whole team is excellent. I would not have somebody not excellent on my team. Like just, you see, I'll be talking too much. Like I just want excellence, period. I went to Stanford. I went to Duke. Like anything I do, I got to do it 5,000,000%. I'm a Virgo. People always say that to me. I don't follow that much, but people are like, oh, you're a Virgo. That's why you want to be like this. No, I just want to like be my very best. I want to be my very best for Jesus. I'm like, God gave me these talents and I need to use them to the full and like really be here to serve. But yeah, long thing to say is like anybody on the team, you're going to love them. Read their reviews. Like these girls are great. Okay. Let's see. Best type of filler to put in your smile lines. Depends on like how thick and thin your skin is. I've used everything from Refine, which is like flexible and soft, to something thicker. If somebody got thick skin, I'm using Radius, Dilute Radius. Like it changes. It really changes on the face. That's why like I don't really talk brands on here, guys, because I use different products on different people. Period. Straight up. And it may change. Their face may change over the years and we end up using a different product. Hi, how often are you in Vegas? I'm usually in Vegas like once, maybe twice a month. I'm going to Vegas mañana, tomorrow. Tomorrow I'll be in Vegas. And yeah, I don't know. My team was telling me there was like one spot at 1:30. I don't know if that one got filled or not. My goal is to get a consult, Melissa, with you this month. Been following for a while. I want to do it. Oh my gosh, I would love to see you. Yes. Like I'm here to like help you make informed decisions, guys. We don't rush. And if you're not ready to make a consult, you can always ask me your questions here. But the consult time is nice because we can just sit and talk and like go through everything. and I've been doing the virtual consults since like 2020 when everything kind of got shut down. And I'm able to usually see what I need to see and be able to extract enough information out of you to build that treatment plan. Unless you're in complete darkness and I can't see your face, it's going to be a little bit hard for me. Then I'll say, you got to send me pictures, or like, I can't, can we get to some better light? Or something like, hey, go this way, so I can see how light hits off your face. Okay, my Fatin said, my mother-in-law came to see you. Best experience she's had killer TMJ for the longest time. Thank you so much. I'm so grateful that she's like doing well. That makes me feel really, really happy. Okay, what's the right age to start? Let me know what you're thinking about starting. I would say in your teens, you got to be using sunscreen. Even little kids, my kids have to wear sunscreen. They get so annoyed with me because I'm like, put it on, reapply it. Sunscreen. Then you want to use your retinoid. Teens, 20s, start that and use it forever. Sunscreen, skin treatments, depending on what you have. Sometimes I see people for acne, like in their teens, earlier on. If they're dealing with acne, we're seeing them earlier. Into their 20s and 30s, they're continuing with acne, we'll be treating skin treatments. I think skin treatments are so great to start early, guys. Like, preserve it while you've got it. And we all don't think about it when we got it. We're all like, oh no. I remember I was in that spot, like, oh my gosh, I don't need treatments. Oh my gosh, this is just for like old people. Like, that's not for me. I'm old now. No, I mean, I'm not really that old. I'm 38. I'm older than everybody else in my office. But, like, you don't even know that you've got it good. And I'm like, we want to keep it like that. Like, we want to preserve that collagen. And so I say starting that early. Most people, when they start seeing changes in volume loss in their face, it's their like late 20s into their early 30s. These are signs. Nobody else. If you're in your late 20s, early 30s, this is what they're going to tell me. They're going to see, like, I just see like this little like line, like my under eye, like a little bit here, like little things they start to see. If they ask their friends and their family, they're like, what are you talking about? You're crazy. You're beautiful. You're gorgeous. And it's true. They're gorgeous and they're beautiful. I get it because I do this for work and I understand how the face ages and like what's going on beneath the skin. So I'm like, yeah, I can see it. Like, I know what you're talking about. Now, do you want to do something? You don't have to do something about it. But like those areas, this is going to get a deeper line over time. This is going to be a deeper line. This is going to be like sunken in. Temples are going to be sunken. But yeah, late 20s, early 30s, where a lot of people will start being like, hey, like, I'm just seeing this and I want to get on top of it. I think that's a nice time. Your natural filler. You are young. You are healthy. Like, if you like, those are even better to like get that collagen growth. Yeah. And then skin treatments, like I said, 20s, 30s plus, keep going. And regular filler depends on what's going on and like how much volume loss you have. I will say, we see a lot of people the last few years after weight loss. I lost 40 pounds. I lost 50 pounds. I've lost 110 pounds. Their faces look different. I lost this over 6 months, over a year, over 3 months. Their face is going to look different because they're going to lose fat in their face. And then that's when we're trying to restore volume with either filler, the natural filler, collagen stimulators. So, okay. I hate my smile lines. Recommend Bellotero CC. Bellotero, I like that filler a lot, but it is a super thin filler. I use that for fine lines, like little old lady, like fine lines, little etched fine lines, not really too lift in the smile line unless it's just like etching. So hopefully that helps you. Also, I mean, I was gonna say, you guys shouldn't really have to know brands. Like, that's not your lane to know. Like, it really should be on your provider to know and to not just pick the filler because it's the freaking cheapest one and they can get $50 more if they use a cheaper one. Like, they gotta, like, that's what I'm saying. See somebody that treats people that look like you and you can see their results and you like them and you do the consult. Like, you gotta have trust in these people. They're treating your face. Don't cheapen out. Don't go to the person down the street because you can save $50, or don't try to pick that other syringe if it's not the right one for you. Like, and that's why I say you don't really know the product. Like, that's going to be on the provider. Yeah, I've just seen so many people that have like, hey, this week, let me tell you 3 instances this week. One lady said, we did our consult April 2024. I was like, yeah, I saw you. And like, I went through her whole thing and I was like, oh my gosh, you're here. And she like, it's been a long time. I'm so happy to see you. She's like, so you told me don't do under eye filler. And she's like, I went and got it like that week from someone else. And she was like, and it was like a horrible experience. Like, it was just super puffy underneath my eyes for months. She's like, she has like some not permanent. It's been over a year. She has pigmentation staining from it. I was like, yeah, I told you don't do that, girl. Like, she's like, it was just cheaper. I've heard that from people. And I was like, don't do it. I'm not even the highest price one, y'all. Like, I'm not like, no, I'm going to do the right thing. Like I'm period. Another lady, she was like, she did her face with me and then she went, I don't know why she did this, somewhere to get her lips done. It dang threw everything off, the whole balance of her face, because now her lips, I can tell what product it is. I can look at people and know what product's in their face. I can tell what product it is. The shape is distorted. I'm like, you shouldn't even come to me at this point, because like your dang lips are like protruding past the chin. That's all we can see now is these lips. Like, why? Because it was $50 cheaper. Like, that ain't it. And then when they have to fix it, guys, it is expensive. You got to dissolve it. You got to break it down. That costs money. I'll be like, go see your provider. They'll be like, I don't want to go. I'm like, go tell them to dissolve it. They did it. They're like, I don't want to see them again. They messed me up. I'm afraid. Well, I'm like, well, now I got to charge you to dissolve it. Like, just because I have a cost to dissolve it. So that sucks. And then they want to like fix it. They want to do it the right way. So I'm like, dude, this costs like triple the money as if you just did it right the first time. So do not rush. I'm not saying you have to come to see me, guys. That's not it. I'm just saying, do your research on your provider. Do not rush when you're getting treatments. Like, go slow. Make sure you research. Don't just pick the random person there. People be like, I went on this Groupon. I'm like, dude, and that's why we're here now. And I went to my friend's house in the garage and this person came from out of the country. I don't know what it was. I'm like, this is now cement in your lips and I don't know how to dissolve cement. So like, don't do that. Period. Like, just don't do it. Do your research. It's your freaking face. It's your freaking face. And you're already beautiful with nothing. You don't need it. Like, so think about that first. And if you really want to do it, just make sure you know who you're seeing. Are they licensed? Are they credentialed? Look at their reviews. Look at their before and afters. Do the consult. Don't rush it. Don't rush it. Don't rush it. Botox and filler will be here. And Botox and filler, I love it and it's great, but like, don't rush it. Even for my patient all the time, I'm like, don't rush, don't rush. If they're like, should I do it? I'm like, nope, let's think about it more. That's not the mindset to be deciding to do these things. I'm like, no, there's no rush. Wait, it's easy to come and do this later. I'll be here. The team will be here. Botox will be here. Like, don't rush. You want to be mindful when you're doing these things. Okay, I need to go. I appreciate you. There says 27. Guys, I usually try to answer every dang question. I am so sorry. I will try to come back and do them. And I'm based in LA. I live in LA. I've got 2 clinics here. That's in Mar Vista, so outside of Culver City. Torrance, and then 1 in Las Vegas. And Rich Auntie said, oh, this is my first live with you. I appreciate you. If you have questions, call us, text us, the number at the top of my page. My team is on it. The girls on these phones I have worked with for years, and they have worked with me side by side in the clinic. They hear me all day. And like, you guys can go, I post these videos, like I post them on the other page. Like I post the whole thing. If you want to watch it, I am consistent in what I say. I'm not going to say one thing and then switch it up. I've been saying the same old thing for 5 years. I've been making videos, putting them out twice a day. Like, it's consistent. The information is consistent. What we're going to do, we're going to build out a treatment plan for you. It's going to be specific to you. I'm going to ask you 5 million questions because I got to make sure whatever I recommend, whatever the team recommends is going to serve you. We're not making random choices. We're not playing around with your face. We see a lot of people of color in our office. I say that. We see everybody, old, young, everybody, all ages, all backgrounds. We see everybody. I say that because not everybody does. And there's different consideration when it comes to different skin types and tones. So that is really something to keep in mind. But yeah, we can do a consult. You can consult. Don't just be like, you don't have to just see me, guys. The whole team is great. We're going to build out the treatment plan. You can do them with Samantha. A lot of people are like, I didn't want to see Samantha. Then they get on a call with her. Then they're like, I don't want to see Ginille. I want to see Samantha. So the team is excellent. I love these girls and like die hard for them. Can we get natural filler if we don't live in California? Do you have to come to the office more than once? Yes. You want to do at least 2 sessions. Like, I just want to be real with you. Like, multiple of my patient consults today were from out of state. And I was like, we just got to make sure, like, I got to see you back. Because it doesn't make sense. I mean, doing one, you're doing like a fraction of the treatment. So yeah, that's just something to keep in mind. Marionette lines, filler, natural filler. Maybe a little Botox to prevent you from making sad face. How many sessions or times to get your transformation in your pictures? Oh, so this is several years in between, but big things I think were the under eye filler, cheek filler, temples, chin filler. Like, yeah, this was like several years. This was 10 years ago for me. So I've done a bunch of different stuff, but go slow with it. I'll tell you, I need to get off this call. At one point when I was like, oh, I feel so sunken, I was trying to rush. I should pull up some ugly pictures so you guys can see. I kept being like, put more. And 2 weeks later telling them, put more. I looked stupid. Like, I just had big cheeks and like balance was off. Like, no, don't rush it. I'm telling you from experience. I'm telling you, I've been doing it for almost 13 years. So anyway, I appreciate you. Does it matter if you get microneedling before or after Botox and filler? No, like some people are doing them on the same day. Well, microneedle and Botox right after, maybe filler depending on what we're doing, like maybe the lips. We just have to treatment plan it. So it's those sort of questions, like we're just like, hey, let's plan this out on our timeline and all of that. Yes, I appreciate you guys. Morpheus 8, I've heard too many people not love it. I'm not trying to like bash brands, but too many people over the years that have done it, they're like, it hurt. I'll never do it again. I didn't see much change. Oh, like, yeah, not, I wouldn't. Or if you want to do it, just research someone that does it all the time and they got great results. Okay. I appreciate you guys. You set up a consult. I will do more lives. I have not come on in a week and I'm so sorry, but I like to do these just so we can like be informed decisions. You might not be seeing me. It's totally fine, but I want you to be informed and equipped for whoever you're going to see and like be ready. So yeah, call or text us if you have questions. You can, through the page, you can book your consult. I appreciate you. And we'll talk through everything. I didn't even get to go through like skincare. Thank you, Ramona. I hope you're doing well. Skincare, we go through all this. Like, show me your products. We'll talk to dermatology, nurse practitioner, Niani, black dermatology nurse practitioner on our team. Like, we got you. Anyway, I'll talk to you soon. I appreciate you guys. God bless you. I hope you have a great